A professional latte artist used over-the-counter decongestants to manage a persistent cold. This is what happened to her heart. LC, a 32-year-old female, arrived at triage with a heart rate of 140 beats per minute and profound anxiety. The oxymetazoline molecules had diffused across the nasal basement membrane, entering the ophthalmic and facial veins to bypass the liver's primary metabolism. As her blood pressure climbed, clinicians had to determine how a common pharmacy staple had effectively mimicked a life-threatening stimulant overdose. Elsie is a competitive barista who prides herself on the precision of her work, yet she was now unable to hold a milk pitcher without violent tremors. On examination, her blood pressure was a staggering 210 over 120 millimeters of mercury. This is a level of pressure that risks immediate organ damage, comparable to the internal force of a high-pressure power washer being turned on the delicate vasculature of the brain. She reported a thunderclap headache, a sudden agonizing pain that felt like a physical blow to the skull, alongside blurred vision. The clinical team noted her heart was stuck in a state of tachycardia. Tachy means fast, and cardia refers to the heart. This rapid rhythm was fluctuating between 110 and 130 beats per minute while she sat perfectly still. Doctors were initially baffled. Elsie had no history of heart disease or stimulant use, yet her body was behaving as if it were flooded with adrenaline. The only clue was a small bottle she had been using every 4 hours for weeks to combat what she called rebound congestion. This cycle of dependency is known as rhinitis medicamentosa. Rhinitis means nose inflammation, and medicamentosa indicates it is caused by medication. The drug acted as a potent agonist on alpha-1 and alpha-2 adrenergic receptors, mimicking a massive surge of norepinephrine throughout her arterial tree. While LC lay agitated in the trauma bay, an emergency physician discovered she had been overusing 0.05% oxymetazoline. This common decongestant is a direct-acting sympathomimetic amine. Sym means together, pathos means feeling, and mimetic means to imitate. It essentially mimics the body's fight-or-flight signals. Normally, a tiny spray causes local vasoconstriction, but LC had far exceeded the recommended dosage. The drug had moved from her nasal mucosa directly into her bloodstream, triggering a systemic adrenergic crisis. Adrenergic refers to ad, meaning near, and ren, meaning kidney, specifically targeting receptors that respond to adrenaline. By flooding her alpha-1 and alpha-2 receptors, the medication was no longer just clearing her nose. It was clamping every blood vessel in her body shut. This transition from local relief to a systemic storm explains why her skin was now cold and diaphoretic. Her heart struggled to pump against a suddenly narrowed vascular highway. Her mean arterial pressure spiked as the systemic vascular resistance climbed over 2,000 dynes per second per centimeter to the fifth power. 3 hours into her admission, the clinical team realized Elsie's heart was failing because it was trapped between two opposing physiological forces. The oxymetazoline had created a stuck accelerator effect. The drug triggered peripheral vasoconstriction. Vaso means vessel, and constriction means narrowing. This clamped her systemic arteries shut. This caused a massive increase in mean arterial pressure and systemic vascular resistance. Imagine kinking the end of a garden hose while the pump works harder and harder. The pressure has nowhere to go but back into the pump itself. This created an extreme afterload, forcing her left ventricle to strain against a nearly impassable wall of pressure. Simultaneously, the drug's effect was causing central alpha-2 agonism, which normally tells the brain to slow the heart down. The peripheral alpha-1 stimulation demanded a frantic pace. This internal conflict manifested on the monitor as premature ventricular contractions, or PVCs, which are extra heartbeats that disrupt the normal rhythm. Her heart was effectively trying to drive at 100 miles per hour while the brakes were slammed to the floor. This intense vasoconstriction reduced coronary perfusion at the exact moment her tachycardia increased myocardial oxygen demand, creating a state of relative ischemia. 6 hours after her collapse, Elsie's body began to fracture under the unrelenting pressure. The medical team observed a focal seizure, a sign of hypertensive encephalopathy. Encephalo means brain, and pathy means disease or disorder. This is a state where high-pressure blood leaks through the blood-brain barrier, causing cerebral edema or swelling. If the pressure spike was not broken immediately, she faced a catastrophic intracranial hemorrhage. Simultaneously, Elsie developed flash pulmonary edema as fluid backed up into her lungs, and her kidneys began to shut down. This acute kidney injury was driven by intense renal artery vasoconstriction, literally starving the organ of blood. Her heart was also suffering from myocardial ischemia. Ischemia means to hold back blood. The oxygen supply could no longer meet the demand of her overworked muscle. To unkink the hose, doctors began administering intravenous vasodilators to forcibly relax her clamped vasculature. 48 hours after her collapse, the storm finally began to subside. As the intravenous medications relaxed her vascular system, her blood pressure stabilized. She woke in the intensive care unit, breathing without the crushing weight of fluid in her lungs. Her recovery required a delicate balance to avoid rebound hypotension. Hypo means under, and tension refers to pressure. If her natural adrenaline supplies had been completely exhausted by the crisis, her blood pressure could have plummeted to dangerous lows once the drug wore off. The medical team explained that by using the spray every 4 hours for weeks, LC triggered downregulation. This is the body's defensive attempt to hide or reduce the number of receptors available to the drug. Consequently, her vessels became unable to maintain normal tone without the chemical, creating a vicious cycle of congestion and overuse. LC began a strict steroid taper to reduce the swelling and disposed of her sprays. She learned the hard way that these decongestants carry a strict 3-day limit. LC eventually transitioned to a standard floor as her heart's ejection fraction returned to a safe range. The ejection fraction is the percentage of blood pumped out with each contraction. LC was discharged 48 hours later with instructions to avoid all over-the-counter sympathomimetics and to monitor for rebound rhinitis medicamentosa. While she meticulously tracked every milligram of caffeine to protect her craft, she ignored the warning on a bottle she viewed as harmless. This case illustrates that when we artificially clamp our vessels, the body eventually loses the ability to regulate itself. Thank you for watching this episode of Anatomy of a Mistake. We hope LC's journey through hypertensive crisis helps you respect the potency of over-the-counter medications. This case illustrates that the narrow therapeutic index of imidazoline derivatives requires strict adherence to the 72-hour maximum usage guideline. This is a composite teaching case for curiosity and education, not a transcript from a real chart. And not personal medical advice. See a licensed clinician about your own symptoms or care.